we in America want a quick fix. And so like if you're having heartburn, we'll give you Nexium, but we're not treating the imbalance in your gut.
You know, being here in Florida, they spray a lot for mosquitoes and no-see-ums. Have you seen the pesticide, insecticide levels affect your patients? Well, welcome to the Taylor Method for Pain-Free Living podcast. This is Dr. Derek Taylor. I'm here with Elizabeth Tringali. Elizabeth Tringali is a board-certified physician assistant and the founder of Tringali Vibrant Health, as you can see in the background there in the beautiful sign. She's a graduate of the University of Florida, where she received her Bachelor of Science and Master of Science degrees, and is a diplomat of the American Academy of Anti-Aging Medicine. Since beginning her career in internal medicine in 1999, Elizabeth is very well known in Palm Beach and around the country for helping patients achieve optimal, vibrant health through functional medicine. Elizabeth, welcome to the show.
Thank you so much for having me.
Yeah, it's great to have you. A lot of people probably wonder, how did you ever get involved in functional medicine in the first place? I mean, you're doing this, you're very successful at it. You've helped a lot of people. How did you first get involved with functional medicine?
Well, probably just like you, I'm sure we have a journey. We are sick as children. I was sick as a kid. I had problems with my kidneys. And so I was in and out of the hospital. And then as I got older, my father had a heart attack. I was probably about 11 or 12. And he brought home all these nutritional pamphlets. And I was reading every single one, eating up all the information and saying, Dad, like you can control heart disease with diet. And he sometimes chose to do that, sometimes chose not to, but it really threw me into wanting to help him holistically. And my uncle in California at the time was doing chelation. He's an MD and he was really well known in Covina, California, James Privatera. He died about 10 years ago, but he was known for doing chelation and he was into holistic medicine. And so whenever I would talk to him, even though I was in Buffalo, New York, he really mentored me into going down this road of treating the whole person versus just treating body parts, which is like, more of a holistic way of going versus allopathic. So as I had this journey with my father, then in college, I started getting sick all the time. I had asthma and allergies, and I was just chronically fatigued. And I thought, for being 17, 18, my freshman year, I shouldn't be so sick all the time and tired. So after going to allergists and doctors in the infirmary and then just saying there's nothing wrong with you, I started studying nutrition and I got my bachelor's of science in nutrition. And I realized you can really heal your gut and heal your body through just food. So again, came back to like when I was 12 with my dad, just getting into nutrition. And from that journey, I realized I had all these heavy metals growing up in Buffalo, New York, where all the steel mills were, even though it was kind of before my time, all that stuff is in the environment and it affects your immune system. Mm-hmm. And I had a lot of yeast overgrowth at that time too. So I read this great book by Dr. Crook, William Crook. It was called The Yeast Connection. Do you remember that book?
Yeah.
He says like a big famous book. So I followed his diet, got on his program, and I felt so much better. I lost weight, my sinuses cleared up, my chronic fatigue was gone, my hair grew better, everything was better. And so that just catapulted me into being in a holistic space. And then we didn't have a lot of money, which is terrible to say, but growing up, we didn't have a lot of money. So when I applied to schools, I got right into PA school. And I thought, I can bring nutrition into medicine this way. I don't have to be a doctor. And so as I became a PA and I realized all the allopathic things I was learning, like all these medications we're using, we're putting a Band-Aid on people and just treating their symptoms and no one's really treating the problems. So I did a fellowship in anti-aging with the American Academy of Anti-Aging. And that opened my eyes to more than just nutrition. There's all these hormones and now there's peptides and there's all these other little messenger ways that we can treat the body without drugs. So that's my story.
Yeah, great. And so looking at the person as a whole, and this is, you wanted to look at person functionally, and this is, I guess, the basis of what functional medicine is. There's a lot of our listeners that are listening right now, and they may not know or be familiar with the term functional medicine. So could you briefly explain what functional medicine is?
Yeah, it's kind of like what it sounds like. We try to find the function of the body, the root cause. What is causing the migraine or the stomach issues or the high blood pressure? We kind of just peel the onion back and look for all the layers, whether it's something genetic or environmental. or dietary, what is the body being exposed to express this gene of whatever ailment or illness you have, whether it's pain or whatever. So we're trying to find that function, that's something that's wrong, and then get to the root cause and deal with that. And on all these different modalities, instead of just, hey, take this blood pressure pill, your pressure's high, or take this medication that's going to turn your immune system off because you have an autoimmune disease like MS. We can modulate all those things. So we're trying to get to the root cause, basically.
And so you probably have patients that are coming into because they've not been able to find success with the traditional allopathic conventional approach to health. Would you say is that the case? Do you have quite a few patients that are switching over? And
yeah, all of our patients have failed, unfortunately, regular medicine. And again, that's what brought me from being a regular PA doing internal medicine and family practice for a few years back into the holistic realm. You can't just get a drug and think I'm going to get healed from this drug. That one drug, and I will write medications if you need to. So I'm not anti-medication. I absolutely will use them. I'll integrate them in if I have to. But we in America want a quick fix. And so like if you're having heartburn, we'll give you Nexium, but we're not treating the imbalance in your gut. You probably have more than just H. pylori. There's probably candida or some bacteria. A lot of people have staph or strep in their gut, and they're coming to me because they want to get off reflux meds, and they've been to 5 different doctors and no one can get them off the medication. So they're frustrated. So yeah, we're seeing people that are frustrated, that been through the whole ringer of like 5 or 6 doctors, or they can't find what's wrong with them. I have a little 15-year-old child right now, and he'd been to 6 different GI doctors for all these issues in his gut. And the stool tests that we have in regular medicine are, I don't want to say they're inferior. They're not checking for many things. So what people have to understand when they're doing blood tests or stool tests, if we're not checking off boxes, they're only just going to get the real basic standard of care. And so if I'm not looking for it in my lab order, you're not going to find the answer. So when he went to all these different doctors for the GI issues, no one was looking for something in his environment. Well, it turned out he had black mold in his house. And the first day he came in, I said, what's going on in the house? Did you have a leak? Do you have this? And I just asked some basic symptoms that go with mold. And we found the answer. And within a few months of going on a program, he's better. But that's your typical patient. They come after seeing a laundry list of doctors, different specialists. And honestly, people aren't asking about what they're eating, what other medications they're on. They don't even look at that a lot of times, and what is going on in their environment. We do take a good health history in regular medicine. So we'll look at like your family history, but no one's talking about like, okay, what kind of preservatives are you ingesting? Are you having an energy drink in the morning that has sucralose, which is basically bleaching your intestines and affecting most of your immune system? No one's asking those questions.
Yeah, and that's what I think what makes your practice so successful is that you dig a lot deeper than your standard commoditized care. You stick on that level, you're going to get standard commoditized results, and they may be prescribed a medication that calms the symptom down, but it's really not getting to the root cause of what's going on. And so I like how you just probe deeper. I mean, that's really the key. So when people come in, you're still doing the basic tests that your allopathic colleagues are doing, but then you also run additional tests because a lot of those tests, maybe they're not getting enough of the information, right? So you have to go outside and look and do deeper other tests that are going to find the root cause. So what are some of the tests that you typically like to run that's outside your standardized allopathic model?
So we check for a lot of infections and toxins and deficiencies. So we might do a GI map or a comprehensive stool digestive analysis, so a stool test, but it's 5 pages of what's going on in the microbiome versus what I used to order from Quest or LabCorp, which is like 2 or 3 bacteria, maybe 5 bacteria if I'm lucky. So I'm looking at the microbiome with that test in a much more functional way. Heavy metal testing. People don't realize the pesticides in Florida are so high. So a lot of us have a lot of tin, aluminum, lead. In Florida, there's a lot of lead in the water. So we'll do a provocation test where we give you some little chelating pills and we collect your urine for 3 hours and we see what poisons were provoked out into your urine that are from your food, your air, your water, which I love. In your office, you have that incredible filter system. I need to get that for my office. But what you drink, and what the animal's drink that you're eating, is going into your body. So we'll do heavy metals, stool testing. And then for infections, if I'm not doing stool, I'll do a urine test called an organic acid test. And it shows me like fungal infections and different bacteria that might be affecting the gut. And then different pathways. Like, so you and your brother could be growing up in the same house and your brother's fine, you're not. Well, genetically, you're not twins most of the time. And so you may have a problem with methylation or glutathione or how your dopamine works. So we can check all that in urine, stool, blood tests. It's pretty amazing the amount of tests that are not offered to the general public that are out there. And they're not standardized tests.
Yeah, I'm just curious. Have you seen also, being here in Florida, they spray a lot for mosquitoes and no-see-ums and whatnot. Have you seen the pesticide, insecticide levels affect your patients in their?
Off the charts. And when I do the urine test, it's a GPL tox test I will do. And everyone's pesticides are so high. Even my organic, people that try to do the best they can, they're high because it's hard to avoid them in Florida. You're breathing that air.
Right.
So,
yeah.
Glyphosate is a big problem as well. And the glyphosate is a huge endocrine disruptor that's in the Roundup, and Florida's full of Roundup, but it's affecting our microbiome and it's linked with so many different ailments that people
Right.
suffer.
You mentioned something earlier. So you mentioned about the toxins that you're checking for, and then as well as the deficiencies. I mean, there's like it's a scale that they're not getting enough, they're deficient in certain nutrients. And then on top of that, they have a high toxic load. And so would you say that's kind of like, that's a major thing you focus on with your patients, both of those?
You have to fortify the cell, and the cell is so malnourished, it's not going to give the signal to make your hormones properly or to make the neurotransmitters properly. So again, even my healthy people that come in eating all organic and perfect, I'll just check a vitamin C level. Now that's covered by Quest or LabCorp, or their insurance will pay for that. Mm-hmm. I don't want to say like more than I'd say 95% of the time vitamin C is low. For whatever reason, B12 gets a lot of hype, but I don't see that many B12 deficiencies anymore, I guess because people know, but I'm seeing a lot of B1 deficiencies, so thiamine, which you need for your brain for neurological issues. I see a ton of magnesium and potassium deficiencies, pretty much everyone. We test vitamin D, now it's been out for a while, but vitamin D, we live in Florida, people think they don't need it because we get it from the sun, but you can't make that hormone from the sun if you're low in A and E and K, or if you have a mutation, I think it's called VDR-TAC. If you have that mutation, it's hard to make it from the sun. So there's all these things involved, and D is really a hormone, and it's important for all the hormones to work. So if you're low in D, you're going to have endocrine disruption, and you're going to have problems with your immune system. And that's something so simple that you can take or test for. And again, it's covered by insurance.
Mm-hmm. Right. Wow, this is really taking a deep dive into some of these issues here that a lot of people don't even give two thoughts for in regards to thinking about. And so when somebody comes in, like they are, they're having some health symptoms, some health challenges, they give your office a call, they come in eventually. What's the process that you take somebody through as you begin the journey of them getting back to vibrant health?
So they'll do a comprehensive health history, which a lot of them complain about because it's like, it takes 20 or 30 minutes. But what they do say after they complain, they're happy because they're like, it made me realize things that I'm not thinking about. Like I had to really think about, what did I eat yesterday? And how many hours sleep do I have? And what am I doing for stress? So it's like all these questions. And then we ask all these toxic exposure questions as well. So after doing the comprehensive history, I review that. And then I'll put together lab testing that I think is appropriate for them, which most of that is covered. We'll do through their insurance, through Quest or LabCorp. You just have to have the right medical codes. And most of these people have the medical codes because I'm seeing sick people. I'm seeing people with MS or Hashimoto's, a lot of autoimmune disease, chronic fatigue, long haul COVID, those kinds of patients. They're not, I do see the healthy patients that just want to increase performance, and those are fun and easy to work with. But most of ours are the sick and the tired, ill type patients. So we'll do the history, I'll order the labs, and then depending what they need, I'll have them meet with a health coach, because I can give them like a good 30 minutes of nutrition with me and some handouts. But some people need a little more hand holding, because after all these years of thinking that the food pyramid is the great way to go, and I tell them, look, it's way too many carbs, too many processed grains, even too many fruits for a lot of people. It's kind of like they're so confused and they don't know what to do. So a health coach is a very important part. If they're not meeting with a health coach, I do have support staff at the office where I have nurses answering questions for them, and they can use their portal to email us. After they do all their labs and get on their nutrition program, they meet back with me after a 28-day cleanse that I put them on. It looks like in your office, you do like a similar kind of detox program, I noticed when I was there. So the reason we put them on that 28-day cleanse is I want to get to the root problem and just see, hey, was it the gluten that you're consuming every day giving you a headache or making you have eczema, or do you really have something deeper that I have to find, like a fungus or heavy metal or whatever it is. So I would say 75% of the time after they do this 28-day detox I put them on, most of their symptoms are better. And they were like, wow, I came in for hormones thinking my hormones were imbalanced, but I realized it was the food I was eating. So and then from that point, I'll have a lot of data, and then I might order more tests, but we'll put them on a protocol of IV therapy, vitamins, hormones if they need it. But I don't start with hormones. It's something like, which they complain about. It's something I give them later, because I really, especially if they're younger, I want their body to make their own hormones.
Right.
And so it's annoying that I have to use all these supplements. I'd much rather just use food, but you're probably having this problem too. It's very difficult to get fresh organic food that tastes good, that's high quality. And you'd have to eat, at this last conference I just went to, it was amazing. They said, they're showing all the data, you'd have to eat 4,500 calories of food a day to get the RDA of all our nutrients.
Right.
I can't do that, and I don't want to do that. And we have people eating 4,500 calories of food right now, but not, they're certainly got nutrients, what I mean?
Right. Yeah.
So anyway, we put them on a program, we do the IVs, we clean them up, and they get better. And some people get better really quickly, and some people it takes a little bit longer.
So you mentioned a few conditions. What are some of the most common conditions that you treat there at your office? Just some people aren't aware of functional medicine. They're not aware of the broad scope of practice that you have and things that you help and people with in regards to their health.
I'm doing a lot of autoimmune disease right now. It seems like COVID has been triggering issues with the immune system, a lot more of allergies than I've ever done before. Chronic fatigue I've always worked on. It seems like that's worse than ever. Working on the mitochondria a lot for that these days, long haul COVID. And then things like basic like asthma, psoriasis, eczema. I've got some MS cases right now, Parkinson's, cardiac, a lot of cardiac people, they'll come in for chelation because chelation had a big study in 2012 called the TAC trial and actually reverses plaque. So we do a lot of that. Those are that pretty much anything that a regular doctor sees is what we're seeing. We're just seeing the people that aren't getting the results that they wanted to with their doctor, or they can't stand being on 10 different drugs and another drug for another symptom. They want to actually get to like, hey, what is the problem so I can get off some of these medications? And we use a lot of the IVs for that because, again, I love my supplements, but how many pills can you take? Then I wind up being the same as the doctors giving 10 different vitamins for things. So when I give an IV, I know you're going to absorb 100% of that IV. All those nutrients are targeted based on your blood test to treat your body. Whereas when I'm giving you a supplement, I don't even know if you're going to absorb, maybe 20% of it with what's going on with the health of the microbiome from the poor eating habits or being on Nexium or different drugs that are affecting the pH of the stomach, right? So,
you made a lot of reference to the microbiome and the gut. Seems like seems to keep popping up in our conversation here. Can you talk a little bit more about that and why that is so important to a person's overall health?
I mean, it's like Hippocrates, right? Let food be your medicine.
Right.
It is it's the only barrier we have from the outside world, right? Like you consume something and then it goes part of your body. So like you've got to take care of that microbiome, and all of the research now is showing that, you've got trillions of bacteria, and that's what's causing the signals to the brain to give you a migraine or to think clearly. That's what's giving you the signal to make the hormones. Now, I think that's that new product out called MitoPure. It's a postbiotic, which is really cool. So it's a bacteria in the gut that's actually making your mitochondria make energy for you. And all it is basically a probiotic. Like, how amazing is that? So the microbiome, that's where we absorb our nutrients. That's where we make hormones. That's where we make neurotransmitters. And we can fix the gut by changing the diet, just drinking different water that's purified and doesn't have all the chlorine and chemicals in it. Even doing IVs, we can fix the gut because I'm able to give amino acids IV that will go right and target to that area versus just drinking things like glutamine, or taking peptides like BPC. So anytime I'm working on the microbiome, I'm working on so many different areas, but this is the main area that everything comes into from the outside world and then assimilates into your body. And if you can't assimilate those nutrients, you're going to have hair loss, skin changes, vision changes, heart disease, and speaking about the microbiome, that also affects, that's the teeth, right? So the microbiome of your mouth. So if you have like root canals or heavy metals in your mouth from all the mercury fillings that were used for all those years, I think they stopped recently, but people still have those fillings, that's affecting your microbiome, and that's going to affect, everything.
You were having a conversation with one of my patients the other day, and you had mentioned about the probiotics and the importance of rotating that. And can you talk a little bit about that when people just take the same probiotic over and over again for
forever? Yeah. Yes. She was telling me she's on the same probiotic for years and it was a really great probiotic. And I was like, it is. And all these probiotics are studied and they have certain strains studied for certain things, but you don't want to keep re-inoculating your colon with the same bacteria over and over. You'll get an overgrowth. And I see that in stool and blood tests. And a lot of the probiotics, they use Saccharomyces boulardii, which I love because it eats yeast, but it is a yeast and it can create more yeast. So you have to be careful with that. And a lot of the products, I won't mention names, but a lot of the products at Whole Foods, they use Saccharomyces, especially for people that are vegan, because it does make B vitamins in the microbiome. Again, you can make vitamins in your gut. But if you keep taking this yeast over and over and over for 3 or 4 years, like these people are doing, you're going to create an issue in the gut and overpopulate it. I see it even with things that are good, like bacillus. So that's why it's important to see someone to help guide you, because most people don't have the time to educate themselves on all the different things, right? And they're not culturing their own stool. So that's where we can help them with that. But yeah, you want to switch things up. You don't want to take the same product forever and ever.
Right. It's interesting. You didn't know this, but that patient that you had talked to at my office the other day, she was dealing with the canker sores. You gave her some recommendations. She went to your office. She got an IV, got on your products. She came in today and she said all her canker sores are gone.
Oh, amen.
You just get the body in balance. You never know how somebody's going to respond, right? You never know that may take 3 weeks for those canker sores to go, or it may take a day. You never know how they're going to respond. But when you get the body in balance and you allow it to function and do what it does, miracles happen, right? You see incredible things happen. And so I'm just going to pick your brain here, and I'm just going to throw a couple of topics out, and I just want you to respond to them. Let's talk about cholesterol. You probably have patients coming and they're all concerned. Their cholesterol is high. Their doctor wants to get them on a statin drug. They're putting on Lipitor or Crestor. Talk about that for a minute or so. You could probably spend a whole show.
Oh, yeah. So your liver makes cholesterol and you need it to make every hormone in your body.
Yes.
And after we go through andropause in men or menopause in women, cholesterol goes up because it's trying to make more hormones. And you need cholesterol for your brain to work so you don't get dementia. So it's very important to not just say, oh, my cholesterol is high, I'm going to lower it. And in the studies, and you guys can Google this, there's so many of these retrospective studies where we're looking at cohorts of people, lots of people, thousands, millions of people. And we're finding people live longer that have higher cholesterol. And that doesn't mean I'm telling everyone to have high cholesterol, because I don't want them to take that the wrong way. Like, you do need to monitor your cholesterol, but it's one piece of the puzzle for the heart. And you can talk to cardiologists and they want that LDL so low, but you'll have people with like a very, very low LDL of things like 50, which is so low, or 30, and they're still having a heart disease. So it's not just the cholesterol. So I look at the big picture. So I look at what are you eating to make that cholesterol elevated? And if it's cheeseburgers and French fries from like a burger joint, I'm going to modify their diet, recheck it, put them on some things to balance their liver. And then if it's still elevated, I'm going to look at other markers like, okay, family history. Did your mom or dad die very young of a heart attack or have a heart attack or a stroke or your brother, etc.? Do you have any heart disease yourself, like high blood pressure, things like that? Do you have a high calcium score? What's your homocysteine? So homocysteine is an amino acid that does cause plaque, and it's correlated with strokes and heart disease. And you treat it with a methylated B vitamin and choline. So I'll look at other things like C-reactive protein. So it's a marker of inflammation in the arteries. These are almost more important, in my opinion, than just cholesterol. Like protein A, if that's elevated, I have to be much more aggressive lowering their cholesterol. If it's not elevated, I've got some time to work with these people. And then once I see the whole picture, I'll put them on chelation because it's clinically proven to remove plaque. I'll use a product called Endocalix. It is made of a bunch of like polyphenols and glucosamine, but what in 4 months, again, clinically proven to remove plaque, and it's natural. I'll work on their gut as well with their diet. And then phosphatidylcholine, there's an IV called PlaqueX, again, clinically proven to remove soft plaque. So I can do all these things, even infrared sauna, red light, all these things are going to help the heart, but I'm not just focusing on what's your LDL, what's your HDL. A lot of people will have a healthy HDL of like 100, which is an excellent number. And then their total cholesterol is like 220 or maybe even higher, like 250. Their cardiologist wants to give them a statin. But that healthy cholesterol is removing the bad cholesterol, sending it to the liver, and it's skewing the total cholesterol. So, I'm not going to say the 250 is so bad if your HDL is 100 and her mother lived till like, I'm thinking of a lady right now, mother lived to like 94, or dad lived till 92, no one had a heart attack, but yet they want you to go on a statin. Why? She doesn't, there's no risk. And especially if the calcium score is negative and she's had a normal stress test, like I don't see the need. And the statins, again, in the literature, are linked with dementia and diabetes. We are seeing an epidemic of diabetes in this country. I've never seen so much insulin resistance. I've been doing this 25 years, which I can't believe. And the children are insulin resistant. And young adults in their 20s and 30s, I'm sure you're seeing this, all this visceral fat people are coming in with, and their hormones. The girls are having polycystic ovarian syndrome, which is linked with insulin resistance, and the boys are having endocrine disruption linked to the insulin as well. And it's affecting their cholesterol at a young age, and they're trying to put them on things at a young age. I'm like, you're going to screw up their whole endocrine system.
Right.
Let's address the sugar. And I think that's way more important than cholesterol. And if you get the sugar down with certain nutrients, supplements, IVs, whatever you have to work, probiotics now, Akkermansia is a great probiotic to lower your insulin and sugar. So if you get that down, generally the cholesterol comes down, and then you can help make the patient feel safe, going back to the cardiologist saying, hey, you know what, I'm just going to watch this, give me a stress test and, monitor my arteries. And
you mentioned statin drugs affecting the brain and causing dementia. And yes, that is, you take out the cholesterol, now they don't have the fat for the brain. But then I've also seen a lot of people that are on statin have that as those statin drugs are one of the side effects that I've seen in my office is back pain.
Oh yes,
it just destroys the tissue in the back. There's so much of the back pain, and a lot of it just came on as soon as they started taking the statin drugs, or shortly after. So yeah, some of these meds they think it's saving their life, but it's creating a lot of other issues for them, that other challenges that they're having. Alzheimer's. It's people are terrified of that. Thinking of the thought of dementia to the next level and losing their memory. Have you been able to help people either prevent that, or people that have that?
Yeah, so I've worked with both. It is much easier to prevent because once you have it to treat it, it's very pricey because you have to do IVs, several of them a week. You've got a lot of products you have to take as well. So prevention is the key in that regard, but you can reverse it. Dr. Bredesen's doing it right now. Dr. Goodnow is doing it right now. There's a lot of clinics popping up, and there's protocols we have to reverse it, but to prevent it is much better. And the easiest thing you can do is work on your diet, do some intermittent fasting, keep your insulin levels low, keep your B vitamins high, keep your good healthy fat levels high. The new research now is I have any in my room, plasmalogens or plasmalogens, and there's these little essential fatty acids that your body makes that help reverse the white lesions in the brain and all the the myelin sheath atrophy issues with the demyelination in the brain from these little gel caps you can take. And there's data showing that these little fatty acids are reversing dementia and Alzheimer's. It's amazing. And what people don't realize about Alzheimer's is it's linked with infections. There's a lot of infections, infections in the mouth, infections in the nose, things like in the environment, like mold will cause dementia and Alzheimer's. They're linking herpes 6, cytomegalovirus, Lyme disease, herpes 1 and 2. All these viruses and bacteria and things are affecting our brain, but no one really talks about that. And there's literature to support that. But they keep working on, things like Namenda or Aricept, which is working on like neurotransmitters, but it's so much deeper. Again, it comes down to the microbiome, honestly.
This is so fascinating. You're like an encyclopedia for anything with health here. This is fascinating. I want to keep I have so many more questions I want to ask you. You want to hear some more from an expert in the field? Hang on for part 2, which is coming up next week.
Well, thank you, Doctor. You're fabulous. And, if anyone, I'm sure all your viewers know you, but I've been to many chiropractors and you have definitely helped me very quickly the most. So I thank you.
Thank you. Okay.
You've been listening to the Taylor Method for Pain-Free Living podcast. We hope that you found great value in this episode. For more information about the Taylor Method and our offices, visit www.drderektaylor.com. Make sure to tune in next week as Dr. Taylor will be providing more knowledge and resources about pain-free living.